Hello, I'm Jian Feng. Thank you very much for giving me a chance to conduct this presentation. I'm the final year student studying social policy and sociology with quantitative data analyst at Leeds University. As a student from BAME group myself, I'm always interested in researching the inequality issues faced by people from BAME backgrounds in the society. And today, I want to talk about the health inequality on BAME group under the pandemic. So the meaning of BAME means Black, Asian, and other ethnic minority groups. There are three sections in this presentation. The first section, I'll talk about the three key issues that lead to health inequality. The second part, I'll talk about why these issues happened. That will help you build out a better understanding. And the final part, I will provide three policy suggestions that will be helpful for you to improve these social issues. Let's move on to the first part. So the first issues faced by people from BAME group under the pandemic is they are harder to access the healthcare resources. So what is the meaning of the healthcare resources? It means the facility and service provided by the hospital and the government, such as the COVID test, the mask, and the sanitizer. And when you get COVID, you can use the resources in hospital for free. However, according to our data, only 34% of the surveys take good care of the patient who get COVID from the BAME groups. And most of them, they are hospital, while the surveys such as home care teams, they are less likely to provide good quality service for people from BAME group. This means that people from BAME group, they are receive unfair treatment from most of the health care supports provided by the government. Secondly, people from BAME backgrounds, they are more likely to catch COVID. Why? This is because the high-risk jobs they are doing. So a lot of them, they are working as the frontline healthcare workers or the drivers of food delivery service, which means under the lockdown, they are the people who are protecting us, while they are more likely to expose themselves to the people who might have COVID. Thirdly, regards to the extent inequality in COVID-19, there's a data conducted in England and Wales in early 2020. Well, 34.5% of people from Black, Asian, and minority ethnic groups are categorized as critically ill COVID patients. However, according to the report from Office for National Statistics, in 10th January 2022 until 16th of February 2022, the death rates of people from BAME group are overall higher than people from majority white backgrounds, while people from Bangladesh and the people from Pakistan, they are more likely to die because of the COVID-19. There's also a gender difference, as you can see on the right-hand side, the photo. Male are more likely to die because of the COVID-19 compared with female. This is also because the high-risk jobs are more likely to conduct by male from the BAME group. Eventually, Black Africans and Black Caribbeans, they are least willing to get at least one vaccine. The reason why for this, I'll mention that in the later section. Financial challenge is another big challenge faced by people from Black, Asian, and other minority ethnic groups. However, they are facing these issues even before the pandemic, where 12% to 18% of them reports they have faced financial struggling, compared with 7% across the population as a whole. Meanwhile, people from BAME group were 47% more likely to get a 0 hours contract. They are also 4% less likely to have a permanent contract compared with white peer group. So what's the meaning of that? It means the people from BAME group, they are less likely to be treated with respect, and they are less likely to receive the benefit from the company because they are not a formal staff member and they have the 0 hours contract. The financial challenge lead to the health inequality is because without the enough money, people from BAME group are less likely to receive better quality of food and waters. and it's harder for them to afford for the medicine under the pandemic. I also want to mention the welfare state benefit under the pandemic. We know in UK, our welfare state policy has been developed for a long period of time. However, people from BAME group are less likely to receive support from the welfare policy. One of the reasons is there is a lack of record showing the number of people from BAME group who apply for the benefits. In the government, there are level of awareness to see the challenge faced by the BAME group when they're applying for the welfare state support. Moving on now, I want to mention why these issues happened. As I mentioned earlier, most of the issue occurred even before the pandemic. So compared with the white majority group, citizens from BAME groups receive less public attention and lack of opportunity to get involved in public discussions. This is because of the job levels of the BAME groups are always lower than the white majority group. Their voice are less likely to be heard because they have less power. And because of language barriers, they are less likely to involve in the public discussions. There's also a lack of data and research related to health status and employment status of people from BAME backgrounds. As a result, the government is not aware of the barriers faced by them, such as the language barriers, and they are unfamiliar with using the internet. This is specific for the BAME group with older age group. People from BAME groups, they show less trust on the vaccine. And the reason of that, according to lots of news agencies, is the misinformation shared in their own community. However, there's also a cultural difference, according to the research. For example, people from Caribbean group, they are more likely to trust the medicine from their own countries, and they are less likely to trust the vaccine. They want to cure from the COVID-19 from their own medicine system. Meanwhile, they always live with more family members within a small space, which makes it easier for the virus to spread. Data also show that from 2017 until 2020, families from the Chinese ethnic group, they are the least likely to receive state support. This includes income and non-income related benefits, while the white majority groups receive the most benefits. The reason for that, again, is the language barriers and the older age group from Chinese ethnic group, they are less likely to know how to use the internet. Before the pandemic, compared to the white majority group, BAME groups suffer more from the 2008 recession. Under the pandemic, these issues has been exposed more, such as higher rate of unemployment, less earning, and higher house costs. Moving on now, I want to talk about 3 policy suggestions. The first one is review the healthcare system. It's necessary for us to take action to set out more research and collect more data about the health condition of people from BAME backgrounds. This includes the mandatory collection of ethnicity data at death certification, and ensure the data can be shared around the public world, so the public can be aware of the hardship faced by the people from the backgrounds, and to raise the awareness of the government as well. It's also important to continue to work with other countries in EU and the international organizations, such as the World Health Organization, to research and prevent from future pandemic. We know UK has worked closely with America in terms of researching the information about the virus. However, it would be even better to work with the developing countries where the virus may be spread differently, and the data should be shared between different countries. I also think it's necessary to create an advisory group meetings led by people from BAME groups. They can collect the feedback from the other citizens from BAME backgrounds before providing feedback and work with scholars, scientists, and local governments. Because the people from BAME background, they are more likely to trust the people from their own backgrounds and provide feedback for them. This can help governments save time while come up with the more efficient policy to improve the healthcare system. We should also improve the mental health of asymptomatic groups, especially BAME groups, by including living condition as one of the key measurements as part of the health reports. Mental health issues usually be ignored and people has discussed more about it until the pandemic have happened. We should include the living condition of the bank group so we can have a better understanding about the mental health issues faced by people from this group and the reason why it happened. As you can see from the right-hand side, there's a graph penned by one of the NHS staff who are trying to show their colleague how to reach out to the disadvantaged group people living in the local community. Our government has set up more healthcare surveys and priority support for people from disadvantaged groups. However, we should continue doing that even if after the pandemic finish. The second policy suggestion, I want to focus on financial recovery in bank groups. Our government should educate and promote more community municipal investments and encourage more people from bank groups to join. What is municipal investment? This means every citizen can invest a small amount of money to support the government who are building the new facility or the sustainable architecture or the hospital. It's a safe investment, and this can help the people from the bank group to receive more income as well. We should come up with more similar investment project like that. The government should also provide more funding support, such as the salary of the frontline workers, because they are the people who work hard to protect us under lockdown, and they deserve more rights and better living conditions. In terms of the welfare policy, it's important to design more financial support and welfare support specific for people from bank groups. We should also provide more translation support on the webpage and teach the older age group how to use the internet so that they face less competition and more passion to apply for these supports. Finally, in terms of business sectors, the employers should improve the diversity of the staff who are working in different job levels. And in every important decision-making meetings, they should invite the staff from all backgrounds to join to make sure every value, every voice can be heard. The final policy suggestions I want to focus on the trust within the bank groups. If the trust is strong between the government and the local community, it's more likely for them to work together to solve the global challenge, such as climate change and the pandemic. We should use more translation tools and culturally inclusive approach when we share the information on social media, which can also work with the influential people to share the information around. Secondly, we should also improve the media exposure on the hardship faced by bank group, such as adding a news feature, adding more news story and interview on the webpage, so that the public can see the hardship and challenge faced by the bank group, and they are more likely to offer support. And people from bank group, they'll feel the societies care about them. Thirdly, we should continue to improve the communication with bank group and listen to their voice. As I mentioned earlier, the advisory group. And in Scotland and Wales government, they already conduct the advisory group. We can do the same to improve the communication between the bank group and the local government to solve the issues together. Finally, we should continue to tackle racism and discrimination within the health service, and we should let the public know we will continue to increase the diverse leadership at all levels in healthcare system. This can help the government understand the people from BAME backgrounds, their life condition better by hiring people from a similar backgrounds. As you can see on the left-hand side, they are the frontline worker from a BAME background who die under the lockdown. They deserve the same rights and the equal healthcare system than anyone else. So I really wish this presentation is helpful. In my opinion, I think the best policy suggestion is the first one, which is the improve the healthcare system by providing the advisory board and try to provide more healthcare support, set out priority for people from the bank group. Starting from this, we can build up more trust and start to think more about how to recover the financial challenge faced by people from bank group. Because through the advisory board, we can talk to them directly and to come up with more efficient policy. I wish this presentation is helpful. Thank you very much for listening. Thank you.